Okay, let's go ahead and get started, everyone. Welcome to today's webinar, Supporting Workers Through Post-Coronavirus COVID-19 Recovery. This webinar is hosted by Medical and Life Care Consulting Services, a case management and nurse consulting firm headquartered in Massachusetts, in collaboration with Professional Physical Therapy. We're excited that you've joined us for this presentation. My name is 𝐒𝐮𝐩𝐸𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵𝐿𝐵 anticipated to run about 50 minutes, with an additional 10 minutes provided for questions and answers. Participant audio will be on mute throughout the duration of the webinar, and we ask that questions are submitted using the question and answer feature within the Zoom webinar dashboard. Post-webinar, we will share a link to where you can access an on-demand replay, along with a link to a short survey. Again, we're excited to host today's webinar and look forward to an opportunity to partner with you. To kick us off, I'd like to introduce our host, Cynthia Bourbeau. Cynthia Bourbeau is President and Founder of Medical and Life Care Consulting Services, MLCC, and has worked as a Massachusetts registered nurse, certified rehabilitation nurse, certified nurse case manager, and certified nurse life care planner for over 3 decades. To you, Cindy.
Good afternoon, everyone. Medical and Life Care Consulting Services is a case management and life care planning company. We work with employees with work injuries, health injuries, and also patients with major medical illnesses that are not work-related. Over the past 9 months, MLCC has continued to work daily with our patients and assist them in treating their injuries. At the same time, we've helped them deal with and maintain progress in their treatment in this present environment of COVID-19. The nurses at MLCC are a committed, caring group of men and women who care about their patients. And so through this pandemic, and when this pandemic occurred, had to think outside the box to be able to remain in their case management roles and bring their patients to a successful outcome. I think that we were all in overdrive during that period, just learning to function in this new environment. However, while working with patients with just a work-related injury, or a patient who had a work-related injury and developed COVID-19 during the process, or for the patient who contracted COVID-19 while they were working, we had to facilitate recovery from that situation. And we found roadblocks to that care that they needed. So this webinar came out of one of the identified needs to help our patients recover. We did research and exploration, calling multiple therapy and treatment sites, and explored pulmonary rehab programs and even cardiac rehab programs to see what was available for our injured workers with residual respiratory symptoms. Like many of you, we had difficulty finding resources during that time period. But during the process, that's when we learned about a professional physical therapy and their post-COVID rehabilitation program. In this webinar, they will share their management of patients dealing with the residual effects of COVID-19. Now, before I hand this over, I'd like to introduce our speakers, Nicole McManus and Sarah 𝐒𝐿𝐵𝐻𝐿. Nicole McManus is a physical therapist and the Regional Director of Operations at Professional PT. She has extensive experience in managing workers' compensation patients, as well as program development and training to improve cost containment and timely return to work for injured workers. Sarah 𝐒𝐿𝐵𝐻𝐿 has a bachelor's in exercise science, a master's in public health, and is the director at Trilogy in Western New York. She oversees 4 sites and is responsible for coordinating physical therapy, exercise, and nutrition services to provide patients with the best possible care. So on to our webinar.
Thank you, Cindy, for that introduction, and we are so happy to be here with you today with MLCC and all of you that are joining the webinar. My name is Nicole McManus, and I'm going to get things kicked off. Just a little background on what we're going to be talking about today. Sarah and I will be describing kind of the current state of affairs as it relates to COVID, especially in the workplace. We're also going to be talking a little bit about why this is so critical for both our nurse case managers that are dealing with contraction of the virus, whether it happened at work or outside of work, and it's limiting a worker's ability to do their job, as well as to the employers directly who have staff who may have had the virus, have survived it, God willing, and are now coming back to work but are still experiencing residual symptoms. So we're going to talk a little bit about why that happens and what we can do about it. So let's get started. We have a poll question to kick this off. How many of you have experienced any negative effects in the workplace because of COVID-19? If you could go ahead and answer, that'd be great.
We're going to end polling in 3, 2, 1. Thanks for your participation.
So as you can see there with the results, 71% of you have experienced some less than positive effects in your workplace, whether that be employees contracting, you yourself contracting the virus and needing to take sick leave, or having trouble getting back to the same level of function that you were at before. So that's a perfect segue into where are we now? So let's just take a look about the country and here locally in Massachusetts about where we are to date. I tried to update this as up to date as possible. So as of last week, Massachusetts has seen over 175,000 cases since the beginning of this, which is dated about March 1st. Across the US, we've got over 10 million cases to date. In the world, we're upping now closer to the 51.5 million cases to date. So obviously, we're in a global pandemic. How is this virus spreading so rapidly? How are the effects leading us to have 207 people that are positive for COVID-19 per 100,000 people winding up in the hospital with more severe effects of this disease? Some of the information that we've been able to gather over these last 9 months was published in the CDC about who is affected more. And what we are seeing is that Hispanic, Native American, and Black citizens here in the US particularly are 4 times more likely to be hospitalized than their Caucasian counterparts. I think that is super important to note. I think that our workforce is a nice melting pot of individuals from all backgrounds, but as an employer and as case managers or insurers, we need to recognize those that are at higher risk and understand why. One of the things that determines risk for more severe disease with COVID-19 has a lot to do with a person's comorbidities or their other health profile that contributes to how their body can manage and fight, so to speak, this virus that no one has ever experienced before. So according to the CDC, the following comorbidities put people at a higher risk for either contracting the virus and having a more severe presentation or having a poorer outcome once they survive the initial contraction of the virus and time period where it works through their system. The comorbidities that are listed here should be shocking to you in the sense that these are the most common comorbidities that we see in adults, especially here in the United States. So obesity with a body mass index of greater than 30, diabetes, chronic lung disease like emphysema and COPD, kidney disease, cancer, and coronary artery disease. For those that are not in a medical profession that are on this call, coronary artery disease is what leads to heart attack and stroke. Emphysema and COPD are respiratory diseases that affect the lungs' ability to function. So when you talk about people being short of breath or needing to take many rest breaks, that sort of thing, they're already, so your population of people that were smokers or, grew up around smokers, that sort of thing, that's all very much contributing to these disease processes. Diabetes, one of the most common comorbidities that we see, second only to obesity in this country. So think about the workforce for a moment and think about the number of people that may have one, if not more, of these very common comorbidities to start, and know that if anyone has one or more of these, they are at risk for a severe presentation when contracting COVID-19, as well as a poor outcome in the end with how they do afterwards. So let's talk about some of the essential workers that have been public and patient-facing this whole time. So healthcare workers and COVID-19, right? Healthcare workers, unfortunately, are some of the unhealthiest people in the United States. High stress, long hours, poor nutritional habits and exercise habits and different things like that. It affects many people, but it definitely affects our healthcare workers. And those factors absolutely contribute to things like obesity, smoking, and therefore some chronic lung disease, diabetes, heart disease, and the latter. So in the spot there on the bottom, healthcare workers that have greater than one of those high-risk comorbidities or are aged above 65 years old have a 40% greater probability of having an adverse outcome if they contract COVID-19. That is astounding. So think about the people who are in front of sick people, right? Just the fact that they're in healthcare, they're exposed to sick individuals, and they have one of those very common comorbidities, they're at a 40% chance of having an adverse reaction. How is that person going to get back to work at their full capacity, knowing that they're starting behind the 8 ball? There was an interesting study done, I found it on NPR, that nursing homes and other facilities like it, like skilled nursing facilities and assisted living places and things like that, who share staff, whether it's nursing staff or nursing assistant staff, custodial staff, things like that, people that work multiple jobs, that they are actually linked to possibly being spreaders of COVID-19 between facilities. And we saw so early in this pandemic the effects of the number of deaths and just severe cases of COVID in facilities like this. So just an interesting thing about how important it is to have essential workers, how risky the job is, anyway, but then you put COVID-19 in there and add some comorbidities, and we've got a big problem on our hands. Other essential workers, there's about 31 million essential workers that have some high-risk comorbidity associated with their health profile. And that means you're talking about over 30 million cases of severe COVID-19 that might prevent a person from being able to return to their normal job or their normal way of life. In addition to that, this article that was published in JAMA this month actually talked about the effect that it has on even their household members. So that essential worker with a common but high-risk comorbidity who contracts COVID-19 goes home to their household, and now we're up to 58, almost 60 million people within their household who are now going to have a similar outcome, because the likelihood that a person who is an essential worker who has one of these high-risk comorbidities, the idea is that their household members, at least one person per household, is probably in the same boat, being either an essential worker or having similar comorbidities. So again, really profound numbers here. an interesting way to look at this. You know, we've all been seeing the stats every week, and it's all over the news, and you know, everything else about the cases are going up, the cases are going up, and some of us scratch our head and say, well, why now? Is it just because it's the winter and it's flu season? Think about how easy this is to spread and how much we need our essential workers, and even now the general workforce that has come back to the office or back, you know, back to work, what they bring home to them and how that continues to spread the virus. So what has the United States done, and what has Massachusetts done in particular? Before COVID-19, in Massachusetts, contraction of contagious or infectious disease wasn't considered a compensable injury as far as work comp goes, unless the risk of exposure was so inherent in the workplace that it was part of the job. So you would imagine this would be, again, probably more hospital workers or urgent care, people that are going to be facing sick people basically on the regular. Due to the pandemic, however, what we're seeing now is state after state, we're up to 19 right now, have executive orders in place that address COVID-19 contraction in the workplace, where we're actually seeing work comp claims being processed due to contraction of this virus that comes from being at work. And this is going to extend beyond our healthcare workers, of course, your grocery store workers, your pharmacy workers. You know, think of just the gas station, the mechanics, the people that were in our blue collar jobs, but that were public facing the whole time before we really knew what we needed to protect ourselves. Something that came out during the pandemic is the Family's First Coronavirus Response Act. These are federal mandates that are made regarding paid leave. It's not just to support the workers, it's also to support the employers, because we need to stop the spread of this disease, but we also need to maintain and retain our employees, right? So they came up with a law where you could have paid sick leave specifically related to COVID-19 if you needed to quarantine because of an exposure or because you contracted the disease, that this would be paid in addition to your normal sick leave benefits. The law helped to create this by giving employers tax credits so that the worker was not the one deciding, do I choose between having a paycheck or potentially infecting more of my colleagues by going to work because I need my paycheck. So that's a positive thing that has come out. It's not a well-oiled machine yet because many of us are still operating with a skeleton crew at work. So we still need to backfill those people when they're out on leave, but it is there to try to stop the spread and protect the citizens of the United States and the business owners from really feeling financial effects of this virus. Interestingly enough, the CDC has come out and recognized now that there's been some time where there's been some studies done and some following of patients after they are through the initial bout of the viral effects. And they're looking at these effects as hospitalization and longer lasting symptoms that are quite common in the population. So the most prominent symptoms that they have found are extended time feeling fatigued or feeling malaise, having this persistent cough that just doesn't go away, as well as dyspnea or shortness of breath. So shortness of breath, again, for non-healthcare workers that are on the call, and malaise, what this means to you is that a worker that has some physically demanding job, or even just has to walk along corridor or climb stairs to get to the office or something to that effect, their lung capacity has been reduced, and it is harder for them to even perform the most basic functions at times. They can also experience dizziness, joint pain, and in more severe cases, for those who were either hospitalized for extended periods of time, those who were ventilated for sure, there is something called post-intensive care syndrome, or PICS, that has a whole plethora of adverse effects to being hospitalized and ventilated in the ICU, basically, for extended periods of time. And that will absolutely affect a person's ability to get back to their prior level of function. So I thought it was interesting because reading up on the American College of Occupational and Environmental Medicine, they now suggest that employers are not only aware that these persistent symptoms are normal, and we see them more often than not with these populations of people who have had COVID-19, but that we should start thinking about reasonable accommodations for the job while this employee continues to recover. So, you know, getting away from the all or nothing in this kind of situation, because this is affecting so many people in the workforce, we'll need to kind of bend the rules a little bit to give people a little leeway so that they can continue to recover and still work. So the bigger question is, and the real point of this webinar is, what do we do with this information? How much can we accommodate employees that can't perform or are having trouble performing their normal job duties once they're back to work? What do we do about these comorbidities that we see in the workforce that increase our health premiums as employers, or that increase the risk of prolonged healing times, even for basic, you know, let's say orthopedic injuries, slip and falls, you know, shoulder injuries, knee injuries that happen on the job? What do we do to mitigate some of that risk, both for those chronic conditions and obviously the chronic conditions combined with COVID-19? The answer is physical therapy with a post-COVID rehabilitation or reconditioning mindset or programming. So I'm going to turn it over to my colleague Sarah to describe a bit more specifically about what we can do to address these concerns.
Thank you for that, Nicole. That was awesome. So as Cindy mentioned, I work for an organization, and what we do is physical therapy, and then we have a medically oriented gym, which is really more or less of a chronic disease management program. And so a few months back, I'm in Western New York, a few months back, unfortunately, all non-essential businesses in our area were forced to close, and which meant gyms, which meant typical, you know, your traditional big box gyms. And so we have some great relationships with a few local primary care physicians who reached out to us and said, hey, you know, we're managing a few patients right now who were diagnosed with COVID, are now recovered from COVID, but we're still seeing lasting long-term effects from it. So, you know, can you guys help? Is there anything that you can do to help? You know, what can we do about this? And we said, sure, you know, we can definitely help, you know, refer them over to us. We'll get them in for formal physical therapy. So once we started getting a few different referrals for these patients who have had COVID, we dove into all the literature that was coming out. And obviously the research came that there is a need to have a rehabilitation program for any individual who is recovering from COVID. And so therein lies the reason why we started this post-COVID rehab, right? The research supported it, the literature was there, although maybe not as great as it is now, and it's still evolving now, but there was a community need for it, and then there was also, you know, from the literature a need for it. So, thank you. So basically what we had already had before even COVID-19 was around is what we call medical fitness programming. And so for any neurological disease or condition, so which is mostly Parkinson's, what we see, we have a pulmonary medical fitness program where we cater to individuals who have had COPD or have pulmonary fibrosis. And then we also had a cardiovascular and still have a cardiovascular program for any individual who have had a cardiovascular event. So whether that be a stroke, a heart attack, any type of, you know, cardiovascular event, we took, because of COVID, what the research was telling us on the after effects of the symptoms, and sort of took this cardiac and the pulmonary program, and then made our post-COVID rehabilitation to form this very specific measurements and I guess you would call it structure to a program, just based on that need. And so basically what we can do and what we have been doing is our goal of the program is to help our individuals return to pre-COVID activities of daily living and ultimately work, right? Because we know that everybody 65 and over is not retired. And then we know that 65 and under are still impacted by COVID, although maybe at a lower risk, but are still impacted. So because we have our physical therapy clinics, and then because we have our chronic disease programming and our medically oriented gym, basically we were able to, one, stay open, which was really important to us because physical therapy is an essential business. And then we were able to create this really great post-COVID rehabilitation program that now we're actually seeing referrals to with the increased spikes in COVID. So think of this model of this post-COVID rehabilitation as a comprehensive care model. And so formal PT is excellent. So, physical therapists can address physical impairments and pain, reduce fall risk with balance testing too, with balance training, I'm sorry. So basically, whether an individual has had COVID or not, and especially if they have had COVID, we're seeing decreased coordination, which is really important all across the board. Functional mobility, endurance, strength, and lung function is something that our formal PT can address as well. So those for the functional mobility, endurance, strength, and lung function are the symptoms that are most closely related to the after effects and symptoms of COVID. So essentially, if we think about the program as a whole in regards to the post-COVID program, what we do is we can refer these patients into physical therapy where they still are receiving a comprehensive orthopedic neuro exam. We're taking, our anthropometric measurements. So we're still taking their resting heart rate, blood pressure, we're getting their weight, their body mass index, we take their waist circumference, because that really is the whole picture. And then COVID specific, we want to know, when did they have COVID? What was their date of, I guess, non-diagnosis or recovery? Are they having severe shortness of breath, which Nicole talked about? Do they have any oxygen requirements? Are they on a portable oxygen tank that maybe they weren't on before? What are their precautions or contraindications? What are their comorbidities, if anything? Because as we know, having comorbidities puts these individuals at an increased risk of contracting the virus, and then also pushes all these symptoms, it makes it that much longer to recover, to have recovery from all these symptoms in COVID-19. And then also medication list and medication compliance. So think of it as a post-COVID rehab program, but we're really looking at an individual's whole health. So really, once an individual meets with the physical therapist, I always say that the physical therapists are the best people to really start with programs and regimens. So there's professional oversight, and then the frequency of which that the patients actually see the therapist is on average 2 to 3 visits a week, which is a lot. So, it's called a medically oriented gym model where there's physical therapy and then there's this chronic disease maintenance program, but it's not a typical gym, which is awesome. And it's not a typical program. And so, we have the high touch is what I call it. The high touches from the professional staff for the supervision to be able to appropriately progress, modify the cardiovascular exercise, the strength training, the balance training if needed, and then ultimately try to get these patients back to an overall improvement of health status. Now, whether that's COVID specific, yes, of course, it's going to be COVID specific. So the shortness of breath, the cardiopulmonary fitness, the loss of strength, trying to address the muscle atrophy if there were any, is also really important. But then because we're testing and taking the body mass index, we do a submaximal VO2 test. So we're looking at other health markers as well as all these post-COVID symptoms to try to help these people and get them on a plan. So the program is overseen initially by physical therapists, and really throughout the program by physical therapists, and then when appropriate, transitioned under the care of the exercise physiologist and the PT to make sure that there's appropriate, that there really is appropriateness of the program. And of course, with the program, there's an educational component, right? So what we've seen at our clinics is maybe just an individual who's unaware of even appropriate oxygen levels and how their oxygen levels adjust with exercise, right? So that's really important, especially with anybody with COVID or recovering from COVID and still has symptoms. So you know how those are going to change in response to exercise, and how over time with continued exercise, strength training, balance training, those oxygen levels are going to improve over time. So this 𝐒𝐲 program and our 𝐒𝐲 programs have done a few different pilot studies in the past, and one that we're actually in the process of doing now. So we had a Harvard Pilgrim Healthcare, where this was before my time, but we took 66 participants and put them through a comprehensive program. And so with all of our medical fitness program, we have certain outcome measures that we're looking for. So obviously COVID, we're looking for oxygen levels, we're looking for rib expansion measurements, and then with our diabetics, we're of course looking for body weight, we're looking for A1C, and then blood glucose levels. So basically, what we found that after 1 year, 0% of our participants actually became diabetic and were diagnosed diabetic, which was excellent because what we could do is correlate that with downstream cost savings. So from that initial study, we then took that a step farther with our local Blue Cross Blue Shield company and said, what if we take, you guys identify 102 to be specific, of your high-risk individuals, and they actually determined, I wish I could tell you what those high risk, how they determined them, but they determined them, and let's put them through a 𝐒𝐲 program, right? So let's push them through physical therapy. Let's start working on strength, balance, cardiovascular. There's a nutritional component to diabetes, or anybody with chronic disease for that matter. And then let's transition them over into the oversight of exercise physiologists, where we're going to be looking at their BMI, their waist circumference, their cardiovascular endurance, and then see if this high touch program can have a difference in, their health status, and then also healthcare costs, because that's really what Blue Cross and Blue Shield was interested in. And so one of the measures we actually did with that Blue Cross Blue Shield study was a PHQ-9, which is a depression questionnaire. And so what we found from that depression questionnaire is that after the study, we had a statistically significant reduction in the depression score. And that's really important. And we didn't know it at the time, but that depression is one of the biggest predictors of healthcare costs. And so we started to incorporate that into all of our medical protocols as well. So fast forward to now, the current study that we're doing and that we're working with is locally, again, with our Blue Cross Blue Shield and Independent Health. They funded us for a 2-year chronic disease pilot program. And so that ends March of 2021. So we are currently looking at 200 participants. We're embedded in a federally qualified health center in downtown Buffalo. And so what we didn't know at the time was that COVID was going to happen. And unfortunately, what has happened is the zip code that we're in and doing that study in has been hit pretty hard with COVID. And by all three cohorts, we have three sub-cohorts of that population. So a third of which are patients of the federally qualified health center, a third of which are the community, and then a third of which are the employees of the federally qualified health center. And so all of which have a super high rate just because of the exposure, and unfortunately because it's in an underserved and minority population, and we know that those populations have an increased risk of contraction, unfortunately, and an increased risk of comorbidities. And so now we're really interested to see not only where their health ends up and their disease status, but now looking at this COVID and impacts from the community level, from the patient level, and then especially from the employee level. So I wish I had more data to give you on that. But unfortunately, because we're still in the study, we don't have any evaluation yet on that. But we know that it's important to cater to employees as much as the patients and then our community as well. And so what we've been seeing when we have an individual referred to us is, this is an example of a case study. So an employee, 55 years old, he contracts COVID-19 outside of works. Unfortunately, let's say he's hospitalized, but we know he is a smoker, and then he has a BMI of over 30, which is an obese state. So unfortunately, what we've seen is our individuals who have been hospitalized from COVID-19, and we've actually seen individuals who have not been hospitalized by COVID-19 and who have come to our facility because they've still been, unfortunately, they still had to quarantine, and they're not quite on bed rest as if they were in the ICU, but they're still quarantined to a specific room in a specific section in their house. And you still have the muscle atrophy, the loss of strength, the loss of coordination, the balance. And in extreme cases for individuals who are hospitalized, they may have some cognitive impairments. And so this is just another example. And as Nicole mentioned, unfortunately, skilled nursing facilities, there are individuals who work at multiple sites and multiple facilities and who could actually be the spreader. So same thing, we have an example of an individual who contracts the virus while working. They're hospitalized, they have severe shortness of breath, and unfortunately developed pneumonia. So this is probably an extreme case. They did not receive phase 1 and phase 2. So this would be a perfect example of an individual who would want to be referred to go through this post-COVID rehabilitation program, right? So probably not appropriate to return to work yet, has severe complications, but this would be a perfect example of an individual who would want to work on all of those components. We know that he rehabbed on his own at home, but we know that home exercise programs are great, but maybe not always work. And so really, for the benefits for employees, to start thinking about a post-COVID program or a COVID program, or even something like a chronic disease program, is that the physical therapy is covered by health insurance. And so, which is really great because there's no out-of-pocket cost to the individual. Once that individual is appropriate to be transitioned to do a more independent lifestyle management, comprehensive care, medical program, they would now be seen under the care of that exercise physiologist and the physical therapist. But because they're not in formal physical therapy anymore, there would be an out-of-pocket cost compared to other services. It's not much. So you could think of it, once the individual reaches a certain point of independence, as a personalized training program, but like I said earlier, with that professional oversight, with that high touch program, with the education of, what I would consider more appropriate healthcare professionals. So really what as an employee, what you would be looking for is improved overall health status and reduced sick leave. So improved self-efficacy and return to work ability and return to prior level of function outside of work. So really that's our goal of any program, but especially this post-COVID program, to return to normal activities of daily living and then work. And then the benefits for employers. So it's not a, you're going to enroll in this program and be out of work for 4, 8, 12 weeks. I mean, the purpose of the program is to make it manageable and help with health costs and health status while still in work. So the really great thing is when an individual meets with their professional is that we go over, what are the job requirements? Are you sitting at a desk all day? Are you responsible for lifting people? Are you responsible for lifting boxes overhead? And all of those job requirements are taken into account when developing goals and activities. So an employee health improves overall. So of course, less sick leave, more productivity, less risk of injury and falls, which is great. And then costs can be handled to fit the needs of the employer. So it can be as a benefit to employees, it can be under workers' compensation, or really just utilizing a company's private insurance plan. And then again, it's really in the best interest of employers for the maintenance and retention of employees, right? I mean, I think all employees now more than ever understand and completely respect when an employer genuinely cares about the health, the recovery of an employee, and again, more productivity, healthcare cost savings down the line, and then helping to promote those healthy lifestyle changes. So Nicole, I'm not sure if you had anything to add before we go into questions.
Thanks, Sarah. I'm sorry for the delay there, everybody. No, I think we covered all of it. I think that I'm real interested to hear from those attendees. If you have any specific questions related to your place of work or what your line of business is as it relates to COVID in the workplace, and then we can answer, questions more specifically as it relates to your situation. Thanks so much for listening, everyone.
Awesome. Thank you, Nicole and Sarah, for sharing such great information. At this time, as they've mentioned, we will shift into our question and answer session. Please use the Q&A tab within your Zoom to submit your questions, and we will moderate them accordingly. Let's get started with the first question. I think we're going to point this one to Nicole or possibly Sarah, but how long does post-COVID reconditioning typically take?
Yeah, I can answer that question. Well, of course, it's dependent on the individual, and it's dependent on, how severe the symptoms are. What we've been seeing is about 8 weeks, and really the first 3 to 4 weeks would be under the care of the physical therapist, under formal physical therapy. And then we have an additional 4 weeks of the medical oversight into more individual programs. So what we've been seeing is about 8, it could be longer, and then it could be shorter as well. But I think, and kind of to add on to that, what we're trying to do is start that post-COVID rehab and then continuation of care for any other comorbidities or health markers, right? So because we're screening for those COVID symptoms, as well as BMI, cardiovascular endurance, body fat percent, waist circumference. You know, it's in everyone's best interest to really continue that on in whatever way possible. But to answer your question, it's really that initial about 8 weeks.
Thanks, Sarah. Here's another question. I think this one's for Cindy. What kind of symptoms did an employee that you may have worked with demonstrate post-COVID?
So we've had patients with a variety of symptoms. So they could be as simple as continued dizziness post illness, or severe fatigue and deconditioning, or they could really have a lot of significant respiratory symptoms, so that, you know, any lifting or repetitive climbing stairs, just climbing stairs, they weren't able to do. So it really varied per person, and there were a wide range of symptoms. And additional symptoms included some of the numbness and tingling and the loss of taste and smell, you know, the milder things that didn't affect their everyday activity quite so much, but were still there and still concerning to them. So it depends on the patient and their experience.
Thanks. And I think this next one's for you too, Cindy. It says, can you tell me what changes you've had to make in your case management of patients during COVID?
Just like everyone else, initially when this occurred, it was very overwhelming. Our business is on-site case management primarily. Doctors' offices were shut down, physical therapy was shut down, but we still had injured workers that we were working with. So we had to develop a system where we made sure that their care wasn't interrupted. So we worked with different therapy groups, including professional PT, to do Zoom therapy. And when, you know, not everyone has the capability or the experience to be able to be on a computer or on a tablet and be able to do a Zoom meeting and figure out how to do that. So sometimes people didn't have the equipment that they needed. So our nurses would gown up and go in and bring a computer in so that they could participate in their therapy during that time period. And then for the most part, we don't directly treat patients with COVID while they're actively ill and contagious. So that was telephonic management during that time and getting them to the right caregivers. But then once they passed the guidelines set out by the CDC, we would jump back in, get them going with their treatment again. So I feel like our case management really didn't change, but how we went about it changed. We did a lot of Zoom meetings. We did a lot of connecting the patients to their doctors via Zoom, by telehealth, by going to their homes to do treatments. There also was a shortage of some healthcare workers during that time period. So as nurses, we had to jump in and do some direct nursing treatments when there weren't caregivers available to do them.
Thanks, Cindy. Nicole, I think this one's for you. Which of your Massachusetts PT facilities are able to provide this COVID program?
Great, thank you for the question. Yep, so in New England, Massachusetts, you know, area of professional PT, we have what I would call centers of excellence throughout the region. So the South Shore, the North Shore, in Boston, and then out in Central Mass and Central Western Mass. And so we have specific locations that provide all of the MOG or medically oriented gym programming. Specifically for post-COVID, however, we have allowed this program to take place in any of our clinics. You know, one of the nice things that we've been able to do, you know, silver linings with this sort of thing, is that even if our facility doesn't have enough variety of let's say the cardiovascular equipment or access to enough to space people out so that they can get more of this exercise programming in once they're done with the formal physical therapy part, we have partnered with the local gyms that are now open so that our staff can come into those gyms, to monitor and supervise our patients that are in that more, we'll call it, it's not independent, it's kind of quasi-independent programming once they're done with the formal physical therapy part. So to specifically answer your questions, the centers of excellence that we've kind of named for this type of programming are our South End Clinic in Boston, our Woburn Clinic about 10 miles north of Boston, Salem, Massachusetts, Haverhill, Massachusetts, Leominster, Massachusetts, and Taunton, Massachusetts, which is on the South Shore. And then we have an additional site in Springfield, which is a little bit west. So plenty of places to service your needs.
Thanks. Nicole, here's another one I think may be best for you. And I think this is an employer who's asking this question, but how do they know when a worker who's had COVID is appropriate? Like, what are their kind of red flags to send them to this type of program, is how I'm reading this, and how do they get started?
Yeah, that's a great question. So I think that, from an employer standpoint, we understand you don't want to plant seeds that are going to lead to more sick leave or lead to claims for insurance. We understand that. But I think an overall awareness of how the employee is doing and how they are performing, it warrants a discussion, from their direct supervisor, to just be like, hey, how are you doing? How is your recovery going? I would think that if people are taking days off during the week, that is not a normal practice for them. If they are asking to leave early or come in a little bit later than usual, if they're showing signs of distress during their normal workday, having to take more rest breaks, looking kind of a bit aloof and out of sorts, I would say, those are probably the symptoms that you're looking at that can be contributed to either the fatigue, the dyspnea or shortness of breath that persists. A lot of the muscle weakness and the dizziness, it's funny how those two things go hand in hand with patients like this. So that's more subtle, but just noticing that the person is kind of off. And then just asking them, how are you doing? Because a lot of times the patients themselves don't realize that these are symptoms of, are latent symptoms of COVID-19 in particular. Thanks.
Sarah, I think this one is best fit for you, and it's about, we're talking about lifestyle changes in fitness. Can you explain why does this program work so much better than a regular fitness program?
Yeah, and I think it's really because from the start, you're put with an individual who you see, as I mentioned, quite frequently. So you see a physical therapist 2 to 3 days a week. It's a super high touch program. The patients develop a really great relationship with the provider, and then get to know staff, obviously, as they sort of transition and progress. And so I think just by the nature of the program, they just develop some really great relationships and rapport with each other.
Thank you. All right, we'll give it about 30 seconds. If you have any final thoughts or questions, please submit them now. All right. In the meantime, thank you for registering and participating in today's webinar. You may access an on-demand playback of this webinar at www.medicalandlifecare.com within about 24 to 48 hours. If you have questions regarding a general case management, post-COVID case management, or accessing a medically orientated gym or physical therapy for either your patients or your employees, please feel free to connect with us at info@medicalandlifecare.com. Again, thanks everyone for participating. We hope that you found this valuable use of your time. Have a great day.